Can you tell me what azygos vein is? Yes, ma'am. Azygos vein, ma'am, is this vein in the back, ma'am, in the posterior part of our thorax, which is unpaired, ma'am. And it will drain this thoracic wall and the upper lumbar region. And it is an important channel that will help in communication, ma'am. So it is helping the caval system communicate. That is the inferior vena cava and the superior vena cava. So the caval system are connected. It is connecting the portal venous system. And also the vertebral venous system. So basically it is connecting this caval venous system, that is the vena cavas, and then the vertebral venous system, and this one is the portal venous system. Tell me the course of the azygos vein. Yes, ma'am. The azygos vein, ma'am, it enters the thorax via the aortic opening of the diaphragm. So here we have the aortic opening of the diaphragm. Via this, it will enter the thorax. Then it will ascend up to the T4 level, ma'am. And here what it will do, it will arch forward over the root of the right lung, and then it will join the superior vena cava from behind of the superior vena cava. So what it is doing is, this azygos vein, it will arch forward and it will join the superior vena cava from the back side of the superior vena cava. Okay, so it will arch over the root of the right lung and ends by joining the posterior aspect of the superior vena cava. Before this superior vena cava pierces the pericardium, right? Before that itself, this azygos vein will join the superior vena cava. How is the azygos vein formed? Ma'am, the azygos vein, ma'am, this is the azygos vein. It is formed by some lumbar veins. So here we can see the azygos vein here. This is the azygos vein, and it is formed by these three, what you can see down here, the lumbar azygos vein. Then here you can see this one. This is the right ascending lumbar vein, and then right subcostal vein. So these three together will form the azygos vein. So which three? Ma'am, the right subcostal vein, lumbar azygos vein, and the right ascending lumbar vein. These three together will give us the azygos vein. And then a lot of other tributaries will join, like the intercostal veins, then the HemiAzygos veins, etc. Can you tell me the relations of the azygos vein? Yes, ma'am. The azygos vein, ma'am, this is the azygos vein. Anterior to it, we will have the esophagus. Posterior, we have the vertebra, we can see here, and also the right posterior intercostal arteries. So posteriorly you have the vertebra and the intercostal arteries. Now coming to the right side, we will have the right lung and its pleura, right? And then we'll also have the great splanchnic nerve on the right side. To the left, right, we have the left side, right? To the left we have the esophagus, trachea. Then you can see the aorta, thoracic duct, which is in the green here they've shown. Then we have the vagus. Okay. What do you mean by HemiAzygos vein? If this is the azygos vein, the HemiAzygos vein is a tributary of this azygos vein, and it actually looks like the mirror image of the lower part of the azygos vein. So I will show. So basically, if this is our azygos vein, our HemiAzygos vein is here, which is resembling very much to the lower part of the azygos vein, and the union of the left subcostal vein, left ascending lumbar vein, and the left azygos vein forms this HemiAzygos vein.